Hello, welcome to today's presentation. Our topic of discussion today is, can a man with AS genotype marry a woman with AS genotype? What are the options for having healthy babies? A man with the AS genotype can actually marry a woman with the AS genotype, but they face a risk of having a child with sickle cell disease, otherwise known as SS, since both carry the sickle cell trait. When two individuals with the AS genotype have children, there is a 25% chance the child will have the AA genotype, that's the normal hemoglobin. There's also a 50% chance the child will have the AS genotype, that is sickle cell trait, otherwise known as the carrier gene. Then 25% chance the child will have the SS genotype, known as the sickle cell disease. To minimize the risks of having a child with sickle cell disease, the couple has a few options. One, they have to undergo what is known as preconception genetic counseling. That means consulting a genetic counselor. This can help the couple understand the risks and options available to them. Two, they can undergo pre-implantation genetic diagnosis called PGD. This is a form of in vitro fertilization, IVF, where the embryos are formed and tested for genetic disorders before being transferred in the uterus of the womb. The embryos without the SS genotype can be selected and transferred. Then the third one is prenatal testing. If the couple becomes pregnant, they can undergo tests such as amniocentesis or chorionic villus sampling, CVS, to determine the genotype of the fetus. 4, they can have IVF with donor eggs. The couple can undergo IVF using the sperm of the man and the eggs donated by another woman with AA genotype. This will help the couple to have children that don't have the sickle cell disease, the SS genotype. 4, they can also opt for adoption. Choosing to adopt a child can eliminate the risk of having a baby with sickle cell disease. In all this, ultimately, the decision is a personal one and should be made after discussing options with a healthcare provider or genetic counselor. Thank you so much for joining us today. We greatly appreciate you. This presentation was brought to you by Care Fertility Hospital, Nigeria's best IVF hospital with one of the highest success rates across Africa. We expect you to join us next time. Thank you and see you again. Bye-bye.